I've been involved with we call it Mr. FASD, Midwest Regional Training Center, since 2004 when they did some of the initial trainings. I have oversight of developing speakers in the state of Kansas for doing presentations in regards to FAS, FASD. We've been training folks across the state and in multiple disciplines, because we have physicians, we have psychologists, we have social workers, we have nurses, and to start to see how they kind of have that new awareness that kind of sets in. I think it's been very kind of rewarding for me, but I think it's also really increased the knowledge base across the state for the number of folks that have now been trained in fetal alcohol issues. This is a wonderful project that's been funded through the CDC, and it's one that we have found to be very beneficial. I think one of the more rewarding things is when I recently did a training, a day-long training. I did one in the morning and one in the afternoon in Wichita, Kansas, and I had over 400 people at the training. And all of those folks were very appreciative. They were court services officer, judges, school personnel, that all were very open to what I was talking about. The school systems oftentimes are feeling these are the children they can't manage. These are the children who end up in out-of-home placements, in residential placements. So I think it's really important in doing this work that we not only think about the educational part, but we also have to think about how do we increase our diagnostic capacities, probably in all states. Oftentimes these children are, quote, the behavior problems, or they're the ADHD child, without really having a clear understanding of really what's really gone on with them. And I think helping the parents see, oftentimes it may be adoptive or foster parents, see that what really is the underlying issues is both I think rewarding, but also I think heartbreaking to some degree, because I think that oftentimes folks are looking for simple answers, and these are oftentimes very complex kids that need multiple services and will for probably the majority of their lives, depending on the severity of their exposure. So it becomes a real challenge, I think, as far as looking at working with these kids. But I think it also is very rewarding in helping people, I think, understand a higher level of education when they're the ones that live with these children on a day-to-day basis. We can look at how do we educate, I think, society to keep in mind that this is a preventable disorder that has huge impacts on the child, and that it's one where we know that there's no safe level of alcohol to use during a pregnancy, and that this education needs to start at a very early age. I would say, junior high probably is not too soon in regards to the impact of alcohol on pregnancy and the potential outcomes.